So guys, today we're going to talk about stress and coping. So guys, stress is a feeling of pressure or emotional strain from life's demands. Now, these demands might be perceived or they may actually be a real stimulus, okay, something you are really dealing with. Now guys, stress is a universal experience. Everybody deals with stress. Some stress is good, some stress is bad. When we look at this, guys, some stress is good in the sense that it kind of stretches us and it causes us to be more efficient with our body systems and that sort of thing in a fight or flight type of situation. But some stress can be bad if it's very long term and it starts to take a toll on our body. Now, stress is going to depend on a number of things. And the first thing is on your cognitive appraisal. Now, this is the way in which you respond to and interpret the stress of your life. Okay, so how you're going to respond, but also how you interpret it. Now, many mental illnesses, when we talk about this, disorders, they actually are where people cannot deal with the stress properly. Now, perception is your mental impression of what you're going through. Sometimes our perception gets skewed based on the fact that we'll have like tunnel vision on what's going on, but that is how we're viewing that stress and that life event. There's also what we would call psychological and physiological events. These are events that are happening in your mental state and your body state, and they are linked together. We also have our feelings, how we feel about certain things, and then there's going to be some symptoms that we do see coming up with stress. Now, coping is the individual's response to the stress. Now, sometimes our coping strategies are positive. They're good strategies. Other times they are negative. They are bad strategies, and they can actually make the stress and the symptoms worse. The whole point of this process is that when a stressor comes in, it sends you out of homeostasis. Okay, so remember your body is sitting at this kind of level. And this is called equilibrium or homeostasis. When something gets out of whack, your body wants to try to put it back. This is that idea of returning back to the homeostasis. So sometimes your responses and your symptoms that you have due to stress are trying to return you back to your initial homeostasis. So guys, when we look at this is known as the general adaptation syndrome. This is what everybody kind of deals with when they deal with stress. So when we look here, we have our homeostasis. This is our even keel. Hey, this is where we are supposed to be. In the first step of this adaptation syndrome, we see that there is an alarm stage. This alarm stage is the initial reaction to the stress. This is going to trigger our sympathetic nervous system, that whole idea of fight or flight. It's also going to trigger the HPA axis. This is the hypothalamus pituitary adrenal axis, where the hormones are going to get involved. So this is that connection where we have quick fight or flight from the sympathetic nervous system, but we also have a longer term help from the endocrine system. Now, the endocrine system is going to release hormones like cortisol, which is called the stress hormone. Now, ultimately, we should see that our body is going to be able to deal with this stress, and it's going to deal with it during the resistance stage. The resistance stage is the adaptation. It's where we're trying to find the most effective and economic way to deal with the stress. So your body wants to be very efficient. It doesn't want to waste too much energy in order to deal with the stress, but it wants to be able to deal with it effectively. Okay, so we want to limit the stress in order to control the cortisol levels. They'll start to drop. Okay, once your body has gotten that stress under control, the hormone levels, especially cortisol, will start to drop in our systems. Now, this is a good thing, meaning that our body is returning back to homeostasis. Hopefully, we don't enter into the third stage very often. The third stage is called the exhaustion stage. In the exhaustion stage, this is where adaptation is failing. Your body is not able to deal with the stress in a proper way. Resources are becoming depleted. You're running out of resources. Signs of wear and tear start to happen on your body. Damage does appear, and this is where diseases start to develop due to stress. This includes emotional disturbances, headaches. We also see insomnia, upset stomach, ulcers that could develop, rheumatic diseases or disorders, cardiovascular issues, and even kidney diseases. And this is where the body is exhausted and it's wearing down due to that chronic stress that we're dealing with. So this is that normal stage, and we should again end at the resistance stage, but sometimes our body goes into that exhaustion. But we want to try to prevent that if at all possible. Now, one thing to do with this whole idea of exhaustion and going into that stage, this can happen with what we call PTSD, post-traumatic stress disorder. This is a condition of persistent mental and emotional stress. This is going to eventually cause the body to go into the exhaustion stage on a pretty regular basis. This is normally going to result from an injury or a severe psychological shock or trauma that's taken place. Now, anxiety is the most common or prominent symptom when we talk about PTSD. However, the individual can deal with depression and dissociation. There's almost always a history of some sort of trauma. Okay, it could be something that happened in their childhood. It could be combined with personality disorders. Family history could cause you to be more prone to PTSD. And then also the severity of the exposure to that trauma that you were either part of or you witnessed. Sometimes it's not so much that it happened to that individual, but they witnessed it. So some characteristics: they must have been exposed to a traumatic event, either actual or threatened, okay, by personal experience. They either witnessed it, they're learning of the events, experiencing it, repeated exposure in some cases to the traumatic event. But then they start to have some intrusive type of symptoms, some things that start to cause major issues for them. Okay. They'll have these spontaneous times that they will cue up flashbacks of what happened. A lot of times this brings back those distressing memories, and anything can almost trigger this. They may have reoccurrent dreams that take place as well. We see that they will persistently avoid all stimuli. This is associated with a traumatic event, and this is where the dissociation starts to come in, because it acts as a reminder to them of what happened, so they try to cut out anything that potentially draws them to that. They may even have even further the dissociative amnesia, where they try to even forget and they don't remember the traumatic event. They've locked it away. It's actually still in there and they're still suffering from symptoms of it, but they can't recall exactly what happened. So again, some symptoms are things like flashbacks, difficulty developing and maintaining relationships. They may be very irritable and agitated. They may deal with pretty severe depression, social withdrawal, and they may even develop a drug dependency. Now, treatment, when we talk about this, is they have to get some sort of treatment because their body's going into that exhaustion stage where now we'll start to see more wear and tear, more physical issues that are a problem. So some treatment for PTSD could be things like hypnosis, stress reduction. They might use relaxation therapy. Physical exercise is also helpful, and even biofeedback. Now, biofeedback is kind of understanding what your body is kind of going into before you have kind of that panic attack and trying to calm yourself down. This is sometimes with deep breathing, meditation, visualization, like where you take yourself somewhere else that you feel safe. Those types of things could be what we call biofeedback. Now, how do we prevent PTSD? Well, this is kind of hard because the big thing is that the traumatic event we can't always control. But can we educate people on how to deal with stress? Of course. Can we help them increase good coping strategies? Yes, we can. And so that is where it comes into play. Also, having a good support system is really important as well. That support system can help you be able to overcome some of these issues when traumatic events may occur. All right, so when we look at stress, guys, there are different types of stress. So one we could look at here is a physiological stressor. When we look at physiological stressors, this could actually be like an injury or an illness that is stressing your body out. These are things like autoimmune disorders, cancer, COPD. A lot of times you're going to look at chronic illnesses that are more of an issue. Hey, diabetes, dementia, organ failure. Again, the list can go on and on. But what it does is it causes the patient to also deal with extra stress on like what's going to happen next and worrying about the outcome of those diseases. We also see that there is the psychological or emotional stressors. These are the most common type of stressors that most people are going to deal with. And again, some of these are good in the sense that they do bring joy, but they do cause stress in your life. One is like birth of a child. It could be a marriage or wedding, caregiving. You may find joy in taking care of somebody, but there's still going to be stress behind that. A change in health, a death in the family or friend, divorce, if you move, violence, finances, job. There could be national events that could add to your stress, parenting, politics, relationships, and again, the list could go on and on. Now remember that stress can be good or bad in this case. If we talk about it being eustress, like EU with stress, it's a good stressor. Right? That's going to be like exercise or even maybe a birth of a child or a marriage. They may be good stressors at those particular points in your life. However, a bad stress we call distress. Distress obviously is where your body is having a hard time coping with that. Now, acute stress is also more common than chronic stress. Acute stress is going to resolve itself pretty quickly. You're able to eliminate the stress response. This is where we have hopefully good coping strategies in that sense, to where we can take care of the stress pretty quickly. We also see episodic acute stress. This is like self-inflicted stress, and this happens a lot of times with people who have type A personalities. They put the stress on themselves by like maybe taking unrealistic assignments, thinking they can do too much, and they fail. Okay, and so this puts a stress on them. They become irritable, they worry too much, and it can cause some physical issues as well. Chronic stress is going to be where we have a reoccurring, constant, sustained demand on the body due to a stress. The threat or pressure that the person deals with, it's actually going to become harmful for their health because it does send them into that exhaustion phase. And then mentally, it can actually cause them to lose hope. If a patient loses hope, guys, it's harder for them to recover mentally and physically. Okay, and so stressors could potentially do that if they are chronic stress. Okay, so when we look at this, guys, stress is normally dealt with in a certain way. And this is going to be the normal process where people are able to deal with stress efficiently and effectively. So the way an individual responds to and interprets the stressors of life is their cognitive appraisal. The primary appraisal is their initial evaluation for the harm to self or to loved ones. And so they're looking to see if this particular thing is going to hurt themselves or someone they love. Now, this could be the well-being of the individual. It could be their self-esteem. It could be their personal values that they feel are being attacked. It doesn't have to actually be a physical type of harm. It could be emotional. It could be psychological. There's a lot of different types of harm. We also see the secondary appraisals, your evaluation of your resources. What do you have available to overcome this stress? What are we going to use to reduce it or eliminate it? Now, again, there's lots of variables that can play into this. One is level of education. Past experiences can maybe help you deal with certain types of stress. Coping strategies, again, hopefully they're good coping strategies. Your values, your expectations, your beliefs, especially if you have a good support system, views, and even your self-efficiency. Can you rely on yourself? If not, hopefully you have a support system that you can also then tap into. And when we talk about a support system, guys, this is not Facebook or Instagram or Snapchat. It's not the internet. It's actual people in your life that can help you overcome the stress and have your best interests at heart as well. So what are some consequences when we don't deal with the stress properly, especially when we look at chronic stress? Well, it can start affecting your central nervous system. When we look at your central nervous system, it starts to affect your cognitive function. People then develop headaches, nervousness, irritability. They may have problems making decisions. They might have difficulty sleeping, like insomnia, memory issues. This is actually damage to a specific part of the brain called the hippocampus. We also see confusion, anxiety disorders, and even depression. Those are all things that could be triggered due to chronic stress. The cardiovascular system may even struggle with chronic stress. This is prolonged increased heart rate and even blood pressure due to your body trying to compensate for that stress. Hypertension could develop. We also see a clogging of the arteries that could happen with arteriosclerosis. Cardiac arrhythmias, where their hearts will skip beats or have irregular rhythms. Heart attacks and even strokes. The immune system, guys, when we have an increased level of cortisol for a long time, since that's the stress hormone, we actually see that it will suppress your immune system. It decreases your white blood cell count. This makes you more susceptible to illness. This is why sometimes when you're stressed, you tend to get sick. It's because the cortisol is actually depressing your immune system. This also potentially could trigger certain kinds of issues like rheumatoid arthritis, multiple sclerosis, asthma, and even trigger some cancer due to the fact the immune system has been compromised. We also see musculoskeletal issues. This is where you get muscle tension, you get that tightness, okay, up here, especially in your traps, like in the neck region. And this is what can also contribute to headaches. You may also have tightness in the rest of your body as well. We see that this can cause pain and discomfort. Okay, you can get especially head and neck pain with those headaches. And then we also have nervous tics that potentially could develop due to those muscles being so tense. The gastrointestinal tract, a lot of times, guys, tells on us when we're stressed. We see that individuals deal with gastritis, where we have inflammation of the stomach, ulcers, irritable colon. This leads to like irritable bowel syndrome. And so you're a lot of times your stomach, your intestines will tell on you based on vomiting and even diarrhea. Sometimes, on the other hand, if you are a stress eater, it could cause obesity and, of course, overeating type of disorders. On the other hand, some individuals, when they're very stressed, they don't eat. And so then they may have issues more like anorexia or a type of binging like bulimia. Your skin, the integumentary system can also be affected. We see that you have an increased hair loss when you're stressed. Skin problems like acne, eczema, psoriasis. You might start to develop ulcers in the mouth and even develop what we would just call dry mouth that happens persistently. Reproduction can be affected with chronic stress. It can decrease your sex drive as well as decrease levels of hormones like testosterone and then also sperm production in males. Production, when we talk about this too in males, it could cause erectile dysfunction and even impotence. In women, we see that it can cause menstrual cycle disorders. They may have what we call dysmenorrhea, where they do not have their period as often or it's too often. It causes their cycle to be upset. This could also increase cramping, fluid retention, bloating, irritability, and even menopausal symptoms like mood swings and hot flashes could start to be triggered earlier on. Now, risk factors. Who's at risk for this issue with stress? Well, remember, this is a universal condition, which means everybody is going to deal with stress. However, there's 3 populations that report increased level of stress, and this is normally due to environmental or circumstantial issues. Lower income Americans, young adults, especially young adults with children, and even women tend to have higher risks of stress. Now, some populations, infants and children, have an issue sometimes with stress, and a lot of times this is due to the low levels of coping abilities. They don't know if stress is good or bad at this point. They're still learning that. Adolescents, they have a lot of development that's happening during this time, psychological, emotional, cognitive, moral, and even with the new hormones, it could cause them to not deal with stress properly. And then also older adults. Social support start to decrease due to the loss of loved ones or even maybe even being abandoned by their loved ones. They have increased physical and psychological changes that are occurring as well. And so this puts them at a higher risk. Now, when we look at an individual, like a specific person, their relationships could cause them to have higher risk factors of stress. Financial issues, their occupation could be very stressful. They may have food insecurity where they've got issues with that, and even health conditions. Or they could have a caregiving role where they feel stretched and they feel very kind of sometimes trapped in that caregiving role without the support that they should be receiving. So these are some of those risk factors. Now, assessment. How do we assess stress? Well, we want to do a detailed history. Now, this detailed history needs to be past and current medical history. It should also be family history, psychological or psychosocial type of history. We need to look for certain stress symptoms in this history like irritability, nervousness, anxiousness, fatigue. If they feel overwhelmed, they've got depression, abdominal pain, indigestion issues, headaches, their sleep cycle is messed up, fatigue, restlessness. Do they have decreased concentration, not being able to focus, dizziness, sweating, and the list could go on and on. Now, how a patient sees stressors is really important. And so getting some of this history might help with that, as well as looking at their actual coping skills. There's lots of different questionnaires out there that can be given to patients for this kind of history that can give us a clue of how they deal with their stress, how they view stress, and also what those coping strategies look like, whether they're good or bad. We would also want to do a physical examination. With these physical exams, guys, we would look for acute phase symptoms like increased heart rate, irregular heart rate, increased blood pressure. Their vitals may be changed. We also might say increased respiration, sweating, dilated pupils, and even tension in their body. If it's chronic, we could see other issues that we saw with like heart disease, stroke issues, immunity problems, things that we discussed earlier in this particular lecture. We may need to do some observations. With these observations, we want to look at their appearance. Do they have good grooming? Because are they taking care of themselves? A lot of times individuals who are not dealing with stress well don't take care of themselves at this point. Their expressions, are their expressions going to be more guarded, or do they fit with what they're trying to tell you? We also see their affect. This is how they're dealing with those emotions and showing those emotions. And so we see that decreased skills could happen where they might have more anger. They may be anxious, not able to deal with their sadness properly. They may even have hopelessness. And these can all be seen based on talking to the patient and sometimes in those physical examinations. Again, questionnaires could be helpful. These questionnaires could be helpful with stress symptoms as well as looking at their coping strategies. All right, so now let's look at treatment, guys. When we talk about treatment, we want to try to do prevention, of course, in primary treatment. This is to implement good and effective coping skills. And so the whole idea of primary is to prevent illness from a result of stress. And this, again, is having the patient try to stay in good health. This is due to good nutrition, exercise, positive relationships, and good self-esteem. Again, easier said than done, but these are things that we want to work towards with prevention or primary treatment. Secondary treatment, there's limited screening for stress and how chronic stress can be an issue. However, questionnaires given periodically, especially during like yearly exams or when they do come to the doctor, could be helpful. Now, when we talk about treatment when stress has already been a problem, we want to have them adapt positive coping strategies and deter maladaptive coping strategies. So we want them to have good strategies and not the bad ones. So guys, when we look at good strategies, these could be things like exercise. These could be biofeedback. They could be doing something that they enjoy, like reading, or taking themselves out of that situation to evaluate it. There's a lot of good strategies out there. Maladaptive strategies would be like overeating or not eating, smoking, running to alcohol or drugs. We want to stay away from that as much as possible. Problem-focused strategies are going to generate solutions to reduce or eliminate the stress. So this is where we want to help with their problem solving skills, critical thinking on how we can get rid of that stress. How can we eliminate it? The emotion focused side of it is going to regulate their emotional response. There's no attempt to actually change the stressor, but change our response to it. Now this is going to be due to where if the stressor is not going to go away. This is something that they're going to deal with the rest of their life. So now we want to adjust how they are responding to that stressor. Then the meaning. This uses your values, beliefs, and goals to modify your interpretation and then, of course, your response. Again, can we look at this more as a challenge versus something that's keeping us down? Okay, there's different ways we could look at that stress. So some positive strategies include things like education, social support. Again, this is a good support system. Exercise, even art therapy might be helpful. Distraction activities, massages, meditation and reflection, music therapy, praying or spiritual resources, relaxation techniques, and maybe even yoga. In my case, yoga would stress me more out, but that's where you have to also know yourself and not utilize those type of strategies if there may be an issue. Maladaptive strategies are things like avoidance, attacking or bullying others, denial, dependency on something, whether it's food, lack of food, drugs, alcohol, even maybe a person, displacement, dissociation, emotional outburst, excessive eating, regression, self-harm. Sometimes that whole idea of like cutting or self-harm could be an issue. Isolation or withdrawal, substance use, and even violence. Those are maladaptive strategies. The last is what we would consider the pharmacology side, the drugs. What could we use with stress there? There's no medications to really treat or prevent stress because, again, it's a universal effect. However, medications could help with some of the issues that develop with stress, like depression, anxiety, and then medications specifically to, like, if they're dealing with heart disease, gastrointestinal issues, headaches, those types of medications may be useful to help with those symptoms or the issues that have happened due to chronic stress. All right, if you have any questions, please let me know.